A saltine cracker can change your life. Hello, mums-to-be. Are you dealing with morning sickness, nausea, vomiting, excessive saliva, dizziness, sore breasts, hemorrhoids, or varicose veins? Pregnancy can be tough, but with care and love, you can get through it much more smoothly. Pregnancy is a time full of changes, care, and lots of love, but it can also be a time of worry, especially because of the symptoms and signs that may arise. Physiological and psychosocial changes are normal and help you adapt to pregnancy, maintain your health throughout, and prepare for your baby's birth. As the baby grows and your hormones change, your body goes through many adaptations. It's important to know that these changes can cause discomfort, but don't worry, these discomforts are usually temporary and often specific to each stage of pregnancy. Most complaints decrease or disappear without medication. For example, in the early days of pregnancy, you might feel nausea, a missed period, bloating, weight gain, fatigue, sleepiness, appetite changes, and increased urinary frequency. Morning sickness and nausea. Morning sickness and vomiting can occur at any time of day, but are usually stronger in the morning. Generally, they start around the 5th or 6th week and should decrease or completely disappear by the end of the 12th or 14th week. Although uncomfortable, these symptoms aren't a cause for concern unless they cause excessive weight loss, fainting, dizziness, or an inability to keep food down. Here are some tips to cope. Eat small, frequent meals with at least 3 main meals and 2 snacks per day. Ideally, eat every 3 hours. Eat something as soon as you wake up. Keep a packet of saltine crackers by your bed and eat one before getting up to line your stomach. Avoid long periods of fasting. Vary your meals according to your tolerance. Eat slowly and chew your food well. Prefer dry foods in the morning, like plain bread, toast, and crackers, preferably whole grain. Avoid fatty and spicy foods, especially fast food. Avoid sweets with high sugar content like chocolate drinks. Use natural seasonings instead of processed ones and avoid spicy foods. Avoid foods with strong odors or those that cause discomfort, like beans. If possible, avoid being in the kitchen while food is being prepared. Drink plenty of water and fluids, but avoid drinking during meals. Don't lie down right after meals. Excessive salivation. Excessive salivation or sialorrhea is more common in the first few months of pregnancy. During this period, you might produce twice as much saliva with a bitter taste and feel like your tongue is thicker and your cheeks are swollen due to the salivary glands. What you can do, besides the tips for nausea, remove dairy products and foods that contain starch from your diet. Between meals, suck on mint or lemon candies or chew gum. Ginger can provide relief. Brush your teeth or rinse your mouth with mint-based products. Weakness and dizziness. Dizziness is more frequent in the 2nd and 3rd trimesters of pregnancy. The main cause is hormonal changes, leading to hypertension, low blood pressure. It can happen due to hypoglycemia, low blood sugar, or anemia. If you feel faint or your blood pressure drops significantly, it's best to sit and lower your head or, if possible, lie down. Fainting is rare during pregnancy and generally doesn't harm the baby. What you can do, avoid inactivity. Eat small, frequent meals. Avoid long periods of fasting. Avoid staying in closed, hot, and poorly ventilated places for too long. Avoid sudden changes in position. Sleep on your side, preferably on the left, to avoid compressing the uterus on the large blood vessels, which can cause drops in blood pressure, especially in the later months of pregnancy. Wear comfortable shoes and avoid high heels to prevent falls and back pain. Shortness of breath. Shortness of breath can occur due to the growing uterus or anxiety. To relieve it, keep your bed's head elevated. Breast pain. Breast pain can occur due to the increased breast volume during pregnancy. To ease discomfort, wear a bra with good support and wider straps. Constipation and gas. High levels of progesterone can slow down intestinal movements, worsened by reduced physical activity in most pregnant women. Additionally, the uterus compresses the intestines, causing gas accumulation. The iron and vitamins you take can worsen the situation, hardening the stools and making bowel movements difficult. What you can do: eat fiber-rich foods, including 3 to 5 servings of fruit per day and varied vegetables in 2 meals. oils. Include fibers sold as medications that can be added to food and drinks. They don't alter the taste or texture, being a great option for those who can't manage their intestines with diet alone. Drink plenty of liquids, at least 2 liters per day. Exercise regularly to stimulate bowel activity. Include yogurt in one of your snacks. Replace white flour with whole grain, whether in bread or other foods, and include whole grains. Avoid laxatives and never do enemas without medical authorization. Hemorrhoids. Hemorrhoids are common, especially in the 2nd and 3rd trimesters. During pregnancy, blood flow increases, the uterus grows, the veins in the anal region dilate, and body weight increases, contributing to hemorrhoids. Discomfort starts with itching and pain in the anal region. Blood in the stool and on toilet paper are also signs of hemorrhoids. What you can do, besides the same measures for constipation, some cases may require ointments or other medications. Clean the anal area with wet wipes, neutral soap, or warm water instead of using toilet paper. Avoid constipation since straining to evacuate increases pressure on blood vessels. Take 2 to 3 warm sitz baths per day to relieve muscle spasms. Avoid standing or sitting for long periods. Sleep on your side, not on your back, to reduce pressure in the anal region. Use cushions to relieve possible pain when sitting. Varicose veins. Varicose veins are dilated, twisted veins visible under the skin, most common in the lower limbs. 1 in 4 pregnant women may suffer from varicose veins. Besides being unsightly, they can cause pain, discomfort, and swelling. In some cases, itching and sores may also appear. Varicose veins tend to worsen as pregnancy progresses and usually improve after childbirth. However, if they persist, seek specialized treatment. What you can do: avoid standing or sitting for long periods. Try to walk every 2 hours. Do moderate and regular exercise, like walking, swimming, or yoga after getting medical clearance. Use compression stockings, which help with blood circulation. Elevate your legs when resting, keeping them higher than your body. Avoid crossing your legs when sitting. Maintain a healthy weight for your stage of pregnancy. Stretch marks. Unfortunately, there is no 100% effective treatment to prevent stretch marks, as they occur due to skin stretching associated with hormonal factors. However, some measures can minimize their appearance. What you can do: control weight gain, avoiding sudden changes, keep your skin well hydrated using creams and oils specifically for pregnant women, eat a balanced diet, including foods rich in vitamins C and E, zinc and silicon, which help with skin elasticity. Drink plenty of water, at least 2 liters a day. After pregnancy, aesthetic treatments like laser and microneedling can be done to reduce stretch marks. Frequent and urgent urination. Increased urinary frequency is a common symptom during pregnancy due to the growing uterus compressing the bladder and increased blood flow to the kidneys. Urgency or the need to urinate immediately can also occur. What you can do: avoid diuretic drinks like coffee and black tea. Do exercises to strengthen the pelvic floor muscles, known as Kegel exercises. Urinate regularly and don't hold it for long periods. Stay well hydrated, but spread it out throughout the day, avoiding large amounts before bedtime. If you feel pain while urinating or notice blood in your urine, see your doctor, as this may indicate a urinary infection. Complaints during pregnancy are common and usually normal. However, knowing how to deal with them can make a big difference in your pregnancy experience. We hope these tips help you feel more comfortable and prepared for this wonderful phase. Thanks for watching. If you like this video, please like and subscribe to our channel for more tips and information on pregnancy and childbirth. We wish you a healthy and happy pregnancy. See you next time.